The increases in obesity rates in the United States brings light to two important questions. What amount of exercise is the correct amount, and how many people are actually reaching it? In general, the basic requirements for physical activity for adults are 150 minutes per week of moderate activity, 75 minutes per week of vigorous activity, and strength training 2 times a week. According to health.gov, we should be doing a minimum of 150 minutes per week of moderate physical activity. Moderate physical activity can be anything like walking, gardening, mowing the lawn, or tennis doubles. This allows us to get our heart rate higher and possibly break a sweat, depending on the activity of choice.
You can also meet the minimum physical activity requirement by doing 75 minutes of vigorous physical activity a week. Some examples of this would be running, hiking, cycling, carrying heavy loads, or most sports like basketball or soccer. This is a form of more intense workout requiring the most amount of oxygen consumption. In the chart, it is evident that as the physical activity level rises from moderate to vigorous levels of exercise, the heart rate rises for individuals of all ages. You can also combine these minutes to get your recommended requirements. For example, running for 50 minutes and walking for 50 minutes would count as meeting the recommendations, since vigorous activity counts for double the minutes of moderate. You can also do these minutes of physical activity for any length of time, whether that be doing all 150 minutes at once or spreading it out throughout the week. This allows for a more flexible schedule so you can manage your time easier. In addition to meeting the minimum weekly physical activity requirements, the CDC also recommends that adults do muscle strengthening exercises at least 2 times per week on separate days. According to Michael Boyle, who's a Boston strength and conditioning coach, strength training twice per week is perfect, but once is just a waste of time. Again, referring to the CDC's guidelines, these strength training exercises should focus on working all major muscle groups like the legs, hips, back, abdomen, chest, shoulders, and arms. And some examples of ways to strength train are things like lifting weights, calisthenics, and other types of resistance training that focuses on all the main muscle groups.
Studies have shown that sedentary behaviors have been increasing over the last decade. Data from 2007 compared to data from 2016 shows that the average sitting time has increased from 5.5 to 6.5 hours per day in young adults, and it has increased from 5.3 to 6.1 hours in older adults. In part, these trends are due to working and learning environments that are hard to avoid, such as adults who have desk jobs will be sitting for the majority of their 9-to-5 workday. College students must sit during class as well as outside of class when they are studying. Sedentary behaviors have also increased due to a lack of leisure time physical activity. Over 50% of the US population spends more than 2 hours per day sitting and watching TV or videos. Over 50% of the US population spends 1 extra hour on their computers doing activities that are not work-related. 24.2% of the US adult population reports participating in no leisure time activity. Sitting time is increasing because many individuals choose to continue sitting even when they have had the opportunity to get up and be active. Ultimately, 50% of US adults are meeting the minimum guidelines for aerobic activity, which are, as mentioned before, 150 minutes of moderate exercise per week. 30.5% of US adults are meeting muscle strengthening guidelines of exercise 2 times per week. So, why are we inactive? Physical activity has been on the decline for years now, but why? For starters, physical activity is no longer a necessity for survival. Only 13.7% of jobs require consistently large amounts of physical work, and a large majority of workers have desk jobs. The lessening of physical activity needed to earn an income has contributed to the fact that physical activity has become a choice. Another contributor to the lack of physical activity in teens and young adults is that 70% of children in the US that participate in organized sports will quit by the age of 13. Reasons for quitting are numerous, such as sports just aren't fun anymore, programs are too expensive, it's too much of a time commitment, and the pressure to win is too high. Once quitting, most individuals have no other supplemental movement, so they become more sedentary and don't exercise regularly. Another common reason for inactivity is that people are not educated on the benefits, so they don't make time for it in their day-to-day lives. Only 30% of students in the education system have daily physical education, so many kids and young adults don't even know how to go about getting exercise. Kids need more physical activity than adults do. Children are recommended 60 minutes of physical activity every day, and not many kids meet that requirement. According to the CDC, only 26.1% of children meet those requirements, and physical activity in kids are on a decline too. Children now spend an average of 7.5 hours a day on a screen, and 1/3 of high schoolers play video or computer games for 3 hours a day. Technology seems to be a big factor in this decline of physical activity, but education has not been helpful either. Only 6 out of the 50 states require physical education in all grades, which does not promote the recommended amount of physical activity at all. As a result of these issues, the CDC states that over 20% of children are now considered obese. This number has been on the incline as well. So why should we care? There are countless benefits to implementing some sort of physical activity into your daily life. Studies show that doing physical activity improves sleep, reduces stress, and leads to better cognition and function of your brain. Some health benefits are that you are able to maintain your weight easier, you have a reduced risk of heart attack or heart disease, you have a reduced risk of osteoporosis or an increase in your bone strength, and you also have a lower risk of blood pressure and the risk of diabetes.